Good afternoon, and thank you for joining me for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in Peel Region, and Tim Lindsay, our Acting Director of Emergency Services here in Mississauga. As we approach the first day of fall, I want to assure residents that we are working closely with Peel Health and our hospitals to respond to any possible resurgence. I know the rise in cases in Peel Region after the Labor Day weekend is a cause for concern. With our community open, all of us are moving more, whether it's to and from school, work, or to see friends and family, and as a result, so is the virus. Remember, we control the spread of the virus through our movements and our actions. It's up to all of us to prevent a second wave. Testing centres at Trillium Health Partners at Credit Valley Hospital and the Mississauga Hospital, similar to many others across the GTA, have been inundated with long lineups this week. Of mostly asymptomatic people looking to get tested for a variety of reasons, whether they're returning to work and need a certificate, taking a trip, visiting a loved one, or they're concerned about a possible exposure. Trillium Health Partners has tested over 130,000 people since the onset of the pandemic and offers more access to testing than any other hospital in the province, network of hospitals in the province. The vast majority of asymptomatic tests are negative. We want to see more people getting tested, but our hospitals need the resources to keep up with the growing demand. The reality is that we will need a total community effort to ensure that people have access to testing. We are so proud of the partnership that has been built and strengthened in this community in the face of the COVID-19 pandemic. I would like to say a special thank you to Peel EMS, our paramedics who have been providing support to our hospital assessment centres to ensure that people who want a test are able to get one. I know the Premier is working hard on a revamped testing strategy that I'm confident will give our hospitals the resources and the capacity they need to meet the growing demand this fall. And I hope will also offer and create more off-site capacity in places such as pharmacies that can focus their efforts on testing asymptomatic individuals. This will help alleviate pressure on our hospital system and ensure that our doctors, nurses, and our paramedics can concentrate on treating those with COVID and a variety of other equally pressing health concerns. I want to thank all the healthcare workers at Trillium Health Partners and our dedicated Peel paramedics for quickly springing into action and deploying additional resources to addressing the increased demand for testing this week. Your efforts over the past 7 months have not gone unnoticed. Working with Peel Public Health, we're keeping this pandemic at bay. You are our heroes. We're working diligently to hold on to the gains that we have made here in Mississauga with an average of 15 daily cases over the past week. As a region, we continue to experience some challenges. Many people live, work, and move seamlessly across Peel, and frankly the GTA for that matter, and that's reflected in where and how we see this virus move. A third of all cases in the past 2 weeks were acquired in the community, and nearly half were transmitted from one family member or a roommate to another through household contact. When you add it up, this accounts for nearly 80% of all new cases. We know that exposure through social interactions continues to be the primary driver of these cases. So please, keep your social bubbles exclusive, and that is to no more than 10 people. We're hearing people take far too many liberties, and frankly, if we're not careful enough, these bubbles just might burst. So when you're visiting other friends or family outside of your bubble, whether it be attending a wedding or a backyard barbecue, it's important to remember that the core four still apply. Keep a safe physical distance. Wear a mask when it's not possible to keep that safe physical distance. Wash your hands. Don't touch your face. And that will help us keep those numbers low. Just because you can gather doesn't mean you should. More people and more interactions increase the risk of transmission, especially if you're not being careful. Limit your exposure, avoid large groups, and don't look for reasons to fill up your social calendar. Think about what you can do in your daily lives and the personal choices you can make to help limit the spread of this virus. The Premier has indicated that he will act swiftly to address the uptick in cases in Peel Region, Toronto, and in Ottawa. And at this time, there is no evidence to suggest that Peel needs to be rolled back to Phase 2. I have asked the Premier to look closely at the unique challenges that Peel Region faces in terms of what's driving our numbers, such as social gatherings, when devising his plan of action. While I don't want to see Mississauga regress, no one wants to move backwards. I understand that our region is struggling and that we need to work together to limit the impact of the second wave. And on that note, I want to send a special thanks to our business community, who I know have been working diligently throughout this pandemic to change how they do business and to ensure a safe reopening of our city. I want to thank everyone who has been doing their part to practice COVID prevention. We know these actions work to slow the spread of the virus. We will get through this, but only if we do our part by staying apart. And this includes adhering to the mandatory 14-day quarantine for all returning international travelers landing at Pearson. I'm hearing far too many stories of returning travelers completely ignoring the mandatory self-isolation requirements set out by the federal government. If you're returning home to Canada or visiting, you need to isolate for 14 days, not 12, not 13, but 14 days, no exceptions. And that means no stopping for gas or groceries on the way home or on the way up to the cottage if you're isolating there. If you need a safe place to self-isolate, there are supports available to you. Again, we control the spread of the virus. We are seeing limited flight volumes right now, but this will increase in the months to come. And I'm concerned that once we open the borders with the U.S., the cases could skyrocket. You only need to look south of the border to see what happens when public health guidelines are not followed or are non-existent. We want to see airline travel resume and know that our partners at Toronto Pearson, they are working diligently to keep our airports healthy and safe. And I want to thank Toronto Pearson GTAA for their efforts. So I am asking residents to please do their part. If you're traveling overseas, self-isolate for 14 days or face stiff fines of up to $750,000 or worse, jail time. This is no joking matter. The Public Health Agency of Canada is working closely with law enforcement across the province to ensure people are adhering to rules, so please take this seriously. And before I turn it over to Dr. Lowe, I'd like to provide a brief update on our council meeting today and the efforts we're taking at the City of Mississauga to keep our residents safe. Acting on the advice of Dr. Lowe, we have extended our mandatory face covering bylaw in all indoor public spaces, including condos and apartment buildings, until at least January 2021. I want to thank residents and businesses for doing the right thing and, for the most part, complying with this bylaw. I also want to thank our enforcement team who have been out and about across our city educating businesses on their obligations and working with a variety of establishments to achieve compliance. The extension of this bylaw also means that restaurants must continue to keep their indoor capacity at a maximum of 100 and ensure that no more than 10 people are seated at one table. I once again want to thank our restaurants and bar owners for working with us to ensure a safe reopening. It's because of your efforts that we have not experienced any issues in terms of outbreaks in these settings. And secondly, and finally, we've moved we've moved a motion to officially extend patio season through our temporary patio program until November 15th. So get ready to bundle up, bring a blanket, snuggle up under a patio heater for your favorite winter beverage. And with that, I'd like to now turn it over to Dr. Lowe to provide us with a brief update. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 3,289 cases of COVID-19 in Mississauga. Of these cases, 2,916 have recovered, 144 are active, and 229 have passed away. Now, 6 weeks into Stage 3, our region has seen our daily new cases find a new level as schools reopen. Besides an increase in returning travelers, these cases are largely driven by a cycle of factors being mirrored in other urban areas right across Canada: workplace exposures, household clusters, and social gatherings. People are acquiring the disease at work, bringing it out to dinner with friends, and those friends then bring it home with them and perhaps on to a family member who then takes it to work. Today, and on the virus goes. Today, we learned that the province is considering reducing the size of social gatherings to help prevent spread. I know this would be very disappointing and some may not agree, but I know that we all agree about how important it is to prevent spread. Together, we will overcome this. The majority of our new cases have been in individuals aged 20 to 39. It's no surprise that they are the most mobile in our community. And I want to be clear that I am not painting everyone with the same brush. The vast majority of our residents do the right thing every day. I'm also not saying that the choice to socialize or party is driving everything. It's also certain that there are some workplaces that are not taking precautions to protect their workers. And I've said it before, we should all reconsider travel outside of Canada, especially to places where the COVID-19 picture is dramatically different. Practicing the core 4 behaviors of distancing, masking, hand washing, and staying home and getting tested if sick will help to limit proximity, duration, and numbers in our interactions. Download the COVID-19 Alert app. Get a flu shot. All of these are things that we can do as individuals to protect ourselves and each other. But individuals can only do so much. Context matters. If you run a workplace in the region of Peel, keep your COVID-19 workplace safety practices current. Keep your staff, visitors, and clients safe. And keep contact tracing logs so that we can keep our businesses and the economy open. We have seen the virus spread quickly in settings where people cannot work from home and where crowding and numbers have not been managed with precautions. This is common in facilities such as manufacturing or food processing plants, in transport and logistics facilities, and also borne out by all the occupational data available on Peel Public Health's website. If you are hosting a gathering, a wedding, a funeral, a get-together, a party, a religious service, remember that this virus preys on our relationships. It lies in wait, relying on the trust that we have for our family and friends, and waiting for us to let them and possibly the virus in to our 2-meter bubble. Remember that outdoors is not a guarantee. Remember that precautions are still needed outside of your social circle of 10. Simple is best in any interaction. Limit numbers, proximity, and duration to keep everyone safe. These measures help stop transmission in the first instance, and where they fall short, I want to remind you that Peel Public Health thoroughly investigates every single case of COVID-19 that is reported to us. This includes cases identified in schools, which we are continuing to track as part of our ongoing partnership with our local school boards. Our contact tracers are professionals that aim to counsel the case, determine exposure sources, and notify close contacts that need to get isolated and tested. If our contact tracers call you, please cooperate with them. Your information and adherence will help to stop spread. The opposite is also true. If you don't hear from Peel Public Health, you're not a high-risk contact. Continue to follow the precautions that you would do every day. Remember, the Core 4 is specific about testing. It says you test and stay home if you feel unwell. If you are well and you haven't been told to get a test by Peel Public Health or the new provincial school screening tool, you likely do not need a test. Please leave our assessment centres open for those who must test due to symptoms or exposures as directed by public health. Our partners in Ontario Health continue to explore how to increase access to testing, and we work together with them, but it's important to preserve the capacity we have now, both by keeping cases down through precautions and only getting tested if sick or as directed by public health. Finally, while I know that our case counts seem to be growing, I am reassured that many of those are linked to known exposures and clusters, and that our hospitalization and mortality rates remain stable. For now, of course. As I've said throughout this time since March, this disease moves in 2-week increments, and what we do now is reflected in case counts 2 weeks hence and in severity a month from now. So let's do our part now to keep COVID down in the weeks to come and our community up and running. Thank you, and I'll pass it back to Madam Mayor.
Oops. Thank you, Dr. Lowe. It's great to see you. And now, before I take any questions, I want to take a moment to thank all the parents and the educators out there. It's the first day back at school for many in Peel Region and in the Peel Public District School Board. Welcome back. I know to be back to school this year has been challenging. Parents are understandably anxious, and our school boards have been working around the clock to accommodate both in-class learning and the rise in demand for virtual online learning. Yes, we have seen some cases in our schools, but public health has worked swiftly to track, trace, and break the chain of transmission. And it's by working together we will keep our schools healthy and safe and ensure our kids have access to the best education possible this year. Thank you. And now I'm ready to take any of your questions.
Mayor Crombie, your first question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Mayor Crombie, how are you?
So well, thank you.
Fantastic. I'm going to talk a little bit about Lakeview Village because it's got a public meeting on the Planning and Development Committee for next week, and the staff report on it makes reference to the district energy and the vacuum waste systems, which are two of the key green initiatives in the project. But it references the fact that municipal money and money from high levels of government will probably be needed to make them a reality. Are you concerned that that is a factor, taxpayer money, in these initiatives for this development as it comes towards a final decision for the official plan amendment?
Yes, certainly, Isaac. These are the types of new initiatives, new programs, new technologies we'd like to implement in the new communities that we're building on our waterfront, both at Lakeview, certainly at Brightwater, even in the downtown core. It's something we should consider with respect to district energy, but it will take 4 levels of government to come together: municipal, the regional government, of course, because that's where the responsibility lays, and the provincial and the federal government to make it a reality. The city could not fund it itself, nor could the Lakeview partners.
My follow-ups for Dr. Lowe. Thank you.
Thank you.
Hi, Isaac. How are you?
I'm good. Welcome back.
Nice to be back. Thanks.
My question is, the NDP MPP for Brampton North, Kevin Yard, is going to table a motion at Queen's Park on Thursday to ask for funding to be sent to Peel Public Health to help with the response to COVID-19. It's obviously down to whether the government votes to accept it, but if they do, what extra resources would you like? Do you need more money for contact tracers, or for testing, or for communications staff? What areas do you think need a boost if that funding was to become available?
Thanks, Isaac, for the question. Certainly we, as with many other health units across the province, have been making do in emergency response since the beginning of January. I think there's a number of areas that we could certainly use some support on, specifically around our ongoing surveillance and epidemiology work. We, as you know, are continuing to release data as we are able to get it, and so certainly supports there. Ongoing infection prevention and control, absolutely we've been grateful as well for the province stepping up and funding 64 school health nurses, but there are a lot of places where I think we could certainly use those resources to respond. Now it's important to note that we have been able to mount quite a bit of a response and a response that managed to bring the first wave under control together with the community with the existing resources that we do have, but it has been a long slog, over 230 days more in emergency response, and certainly any additional resources that we're able to have to relieve the staff that have been running this for so long and also enhance some of our offerings would certainly be something that we would be willing to explore with anyone who's able to provide. Thank you for the question.
Dr. Loh, you might just want to stay up there. The next question's for you.
Sure.
The next question comes from Wendy Lung from the Globe and Mail. Wendy, please go ahead.
Dr. Loh, thanks for taking my question. I was hoping you might be able to elaborate a bit on the circumstances in which transmission of the bulk of the new cases are occurring. For example, what is the nature of the household transmission and the nature of the social gatherings?
Absolutely, I'm happy to do so, Wendy. So as was mentioned, in general, what we're seeing is this cycle where there are certain workplaces where there are precautions not being taken, and then there are people that are returning home. A lot of the household transmission that we're seeing, it's rather challenging because many people consider their bubble their close contact, their sort of, consider their household their bubble, right? They're already in close contact there. And so that really speaks to the need for us to keep transmission down throughout the community in order to make sure that it doesn't get into houses, because once it's in houses, not many people are taking precautions at home, and that's what we're seeing through the close contact transmission in households. And then in respect of social gatherings, it's interesting. We've seen the whole gamut. So it's certainly been a lot of the gatherings that have received a lot of attention in the media, but we've similarly seen situations where people they saw someone they hadn't seen in a while. There's a recognition that it's much more exciting to see someone in 3 dimensions than in 2 dimensions, and certain liberties as the mayor were taken and resulted in transmission because the trust is there. And so it's really important to remember who's in your bubble and to make sure you're taking precautions outside of those and really trying to limit the number of people that might be at any gathering at one time.
Right, and sorry, just to follow up, you mentioned that certain workplaces are where people are bringing the virus into their households. Can you tell me what kind of workplaces?
Absolutely. As I mentioned in the remarks, we're seeing transmission in workplaces such as manufacturing, warehouses, transport and logistics. Typically, the rule of thumb is we are seeing transmission in workplaces not typically open to the public, but where you cannot work remotely, you cannot work from home, and if precautions aren't being taken, the virus finds an easy, fertile ground to spread. And and that's essentially the picture of what we've seen here in the region of Peel so far in workplaces.
Thank you, Dr. Loh. The next question is for Mayor Crombie.
Oops. Hi, I'm here.
Hi, Mayor Crombie, your next question comes from Ashley Newport from Mississauga.
Hi, Ashley.
Go ahead.
Hi, Mayor Crombie. How are you?
I'm so well. How about you?
I'm good. This question is for both you, and Dr. Loh could probably weigh in on it as well.
I'll bring him up. Thanks.
But so today, obviously, the Premier was talking today about how in the coming days, the province will probably make some changes to gathering limits in hard-hit places like Peel and Ottawa and Toronto. This probably comes as a relief to businesses, but it also seems like it might be harder to enforce if a lot of these transmission chains are happening inside houses or private parties or private social gatherings. So I'm wondering if you or Peel Public Health have kind of started to talk about how you will police or enforce lower social gatherings, especially since the weather's getting colder. You can assume more people will be inside, possibly inside private households. How will you manage to ensure that people in the city are socializing with less people if they're indoors, especially if they're in private residences?
Right. It's an excellent question, Ashley, because we are hearing the province is preparing to reduce the numbers who will be permitted to gather outside and indoors with respect to social gatherings. So it may or may not affect weddings, funerals, banquet halls, but we aren't sure yet. We will have to obviously wait until the Premier makes the announcement. But enforcement is very key for us. And you realize that the approach we have taken is one of education and information, but we also do act upon complaints. So when the public makes a complaint, for instance, for example, that there is a house party occurring at a certain residence, our bylaw will come into action and go visit the residents almost immediately. It's tougher to enforce if we're unaware of it, as you well know. They have taken also a proactive approach when it comes to touring different types of establishments. We know that they have been to restaurants and bars and adult entertainment facilities, by example, and they have worked with anyone who was not in compliance to get them into compliance. But why don't I ask Dr. Lowe to take a shot at the response with respect to enforcement of these difficult social gatherings that sometimes we're unaware of.
Yeah, Ashley, thanks so much for the question. I think the enforcement piece is really only just one part of the puzzle, and certainly we will work with our various enforcement partners to respond to complaints as Madam Mayor has identified. I think the bigger message is really the idea that we are still in the middle of a global pandemic, and especially with this cycle that I've been describing of workplace to home to social gathering to workplaces and all in between. Really at this time less is more, and as I've described, it's about limiting numbers, duration, proximity, and just using myself as many people have asked me personally throughout this pandemic. They're like, you must be the biggest introvert on earth, and I'm like, no. And as a matter of fact, I actually really enjoy big get-togethers, big family gatherings with friends out on a Friday night. I miss all that. I saw my parents for the first time in 6 months. On Labor Day, we bubbled with them after 6 months of virtual calls, and the reality is I'm limiting my own interactions as much as I can. I'm also a little saddened that karaoke is probably going to be the very last thing that ends up coming back in all of this. I mean, just given everything we've seen with the transmission. But what I'm trying to say is that now is a very difficult time to celebrate, and I think people need to be sensible in keeping numbers down and making sure they're getting what they need out of their social interactions, but also they're making use of other things. I mean, we've all learned how to use Zoom, we've all learned how to use other venues as well, and I think it's a matter of trying to find a balance that keeps us happy, keeps us connected, but also keeps the risk down for all of us. I hope that answers the question. Thank you.
Thank you. I'm back.
Mayor Crombie, your next question comes from Sarah from CTV News. Sarah, please go ahead.
Hi, Sarah.
Hello,
Sarah,
Mayor Crombie.
unmuted your
Hope you're
line.
doing well today.
Very well, thank you. Thank you for joining us.
Of course. Thank you for taking the time. We heard from a parent today that they've had to wait about 7 hours with their child for their child to get a COVID test at Credit Valley Assessment Center. Mm-hmm. Is that the type of wait time that's to be expected?
Oh, sadly, we have heard those scenarios, and this is what I was speaking about during the press conference, and this is something that the Premier is creating a strategy and an action plan around. Unfortunately, over the past couple of weeks, we have been inundated with requests of largely of asymptomatic people who would like to be tested, and they want to be tested for a number of reasons. Perhaps they believe they've been exposed, perhaps they need a certificate to come back to work or to travel or to to visit a loved one, as you know, you need to have proof of a negative COVID test before you can go into a long-term care facility to visit a loved one. So we have been inundated. We are hearing, of course, that there are hour-long waits. And let me also thank our Peel paramedics for assisting at Trillium Health Partners with the registration and the swabbing. They've done a fantastic job. But this is exactly why we need to release some resources and increase community capacity. So the Premier is talking about private companies taking on some of the testing, particularly in the high non-risk category, such as asymptomatic individuals who just want the test for their own reasons or their own security or or their own confidence. So why don't I pass it on to Dr. Lowe to share with us what he knows, but it's very likely that the Premier is close to announcing that there will be more community capacity with an outside private company who will provide, or which will provide additional testing capacity. Over to Dr. Lowe.
Thank you very much, Mayor Crombie.
Yes, thank you, Madam Mayor, and certainly to the question, I think it really speaks to what I was saying in my remarks. It's both a need to increase the testing and certainly areas and availability and access, and I know that that's something that's being explored at the provincial level and with our colleagues at Ontario Health, doing so where it makes sense. But to a large extent, we also need to remember that at this point in time, especially with the success that we've had to date of bringing transmission rates down somewhat from the peak, that really the focus should be on testing people who are either symptomatic with potential symptoms of COVID-19 or who may have been exposed at this point in time. And it really speaks to the situation where, I'm not able to comment obviously on the specific circumstances, but we want it to be so that individuals who need to get tested are able to get it done so in a timely manner. And it's not a matter of just waiting on the front end. We also have to remember that if we're doing a whole ton of tests, and particularly ones that may not necessarily be high yield, you're also going to be waiting for on the back end for the results to come back as well. So it's both about making sure that we're expanding capacity and access where it makes sense, but also revisiting whether it really makes sense to be testing anybody and everybody, particularly when we know and have ideas where transmission may be occurring in our community. Thank you for the question.
Thank you.
Mayor Crombie, your next question comes from Steve from the Mississauga News. Steve, please go ahead.
Hi, Steve.
Hi, Mayor Crombie. How are you?
I'm so well. I hope you are as well.
I am. Thank you. I just wanted to clarify the point about testing here. Until there is new capacity opening up, as Premier Ford is suggesting, is the advice at this time not to get a test at a Mississauga Assessment Centre if you don't have symptoms?
I'm going to ask Dr. Lowe to clarify and to respond to you. Okay? Dr. Lowe, please.
Yeah, so Steve, thank you very much for the question. With every reported case of COVID-19, Peel Public Health undertakes an extensive contact tracing investigation, and particularly an outbreak investigation where a lot of cases are identified. In the course of those investigations, we will identify people who are high-risk contacts who may then need to be tested and self-isolate. At this time, it's recommended that those are most of the people that really should be tested, asymptomatic individuals who have been exposed or who, through the line of their work, are at a greater risk of being exposed, such as healthcare workers, frontline workers, etc. To a large extent, this has actually been the criteria that has been specified in provincial guidance documents back earlier on in the pandemic, and it really speaks to the idea that right now, especially where there is a lot of increasing questions and concerns in the community, we really want to make sure that our testing is focused at tracing out those chains of transmission where an exposure has occurred, and also identifying potential new chains of transmission where someone is symptomatic. So if someone is completely asymptomatic, no high-risk exposures, no high-risk occupation, especially just given the volumes we're seeing at testing centres right now, I urge them to either reconsider or possibly consider returning at a later time, perhaps where more testing options are being made available. Thank you.
Thanks, Dr. Lowe. And it's a second question for
I'm here.
Mayor Crombie.
Thanks.
Hi.
Hi.
We learned in the staff report last week that it was around 900, above 900 complaints around restaurants potentially not following mandatory mask rules, or in some ways the restaurant or patrons in the restaurants like not abiding by the specific rules for restaurants in Mississauga. I know the city does have the education and education first kind of approach, but given the situation with cases rising in the city and in Peel more generally, is the city kind of moving to a position now to do stronger enforcement of restaurants' complaints?
Thanks for the question, Steve. I'm just looking back here at the number of complaints, and I do have Sam Rogers on the phone, and may ask Sam Rogers, who's head of our bylaw and enforcement, to comment as well. But certainly, as you know, we've always taken the approach that education is primary, and we want to work with our businesses and our business establishments about coming into compliance and using it as a learning opportunity to let them know what they're not doing correctly. Perhaps it's signage, or perhaps too many people at a table, or whatever it might be. We work closely with them. Just looking at face coverings, public complaints in businesses. So, you know, since July, we have been more, I'm going to ask Sam to comment, but I think ideally we prefer here in Mississauga to take the approach where we're here to inform and educate rather than be punitive. Certainly, if there is a repeated non-compliance, we wouldn't hesitate to issue the fine. Okay? Sam, are you on the line, and did you want to comment on this issue?
I am. Thank you very much, Mayor Crombie, and good afternoon, Steve, and all members of the media. And thank you for the reference to the corporate report. Just to give a bit of a broader perspective and more current numbers, my teams over the past 2 months proactively inspected over 2,000 business, restaurant, bar establishments, proactively to ensure compliance with the face covering and drinking establishments bylaw. What we have found is that there are a number of violations, but it's not a result of intentionally violating the bylaw. It's a matter of misunderstanding the rules, and specifically around signage and the policy requirements for the face covering. So our officers have educated those 2,000 establishments and brought them into compliance without needing to write a ticket. If we re-inspect and there is a continued violation, we will absolutely act, as the mayor's already referenced. And we do have a record of writing tickets throughout this pandemic. We do not hesitate to shy away from those. Another point on the public complaints, I don't want you to misunderstand that a public complaint necessarily equals a violation. What we are also finding is the public doesn't understand all of the rules. There are many layers with our stage 3, our face covering, and our drinking establishments, and oftentimes members of the public require education. That said, we investigate every complaint we receive, but they often are, misunderstandings about, for instance, the face covering bylaw, where the public don't recognize that there are exemptions and expect that everybody has to be wearing a face covering at all times, when we all know there's a lot of different reasons for people who aren't medically able to wear a face covering. So there's education both on the public side as well as the business side. Overall, we're seeing a great deal of compliance and willingness to work with us, as the mayor's already said. So we're comfortable where we're at, but absolutely, if fines increase and we regress a little bit, we are always monitoring and assessing our enforcement practices, and we'll be prepared to act, with escalated enforcement action. Thank you.
Thank you, Sam, and thank you, Steve, for the questions.
Mayor Crombie, your final question for the day comes from Khaled from My Second Home TV. Khaled, please go ahead.
How are you?
Hello, Khaled. Welcome. Thank you for joining us again today.
Thank you. Yesterday, I ran a feature about the city's program about windrow, and I received lots of questions and feedback as well. A certain audience asked whether the 300 spots were reduced. Can you please?
You've cut out, Khaled. But I guess your question is on the windrow program and certain
on that?
certainly, Khaled, just repeat the tail end of the question. You said certain audiences were inquiring about the windrow program and whether it's been cut this year. Is that
300 spots.
in spots? So the answer is that the Windrow program is always raised during budget time. It unfortunately is a very expensive program that doesn't benefit everyone, because we would need to purchase very expensive new equipment that we find difficult to store, and in addition it wouldn't clear all our streets. It's certainly the Windrow machines that need to be attached to our snow removal equipment don't fit on all our boulevard, all our cul-de-sacs and our small courts. So unfortunately it wouldn't benefit everyone. However, and is also very costly, and in this time of pandemic when we are running a very serious operating deficit of $60 million, I wouldn't want to be adding new expenses to our budget. That said, there is a program where our seniors and those with disabilities who have a need and a financial need may apply for assistance, and we do have a program that those individuals will receive some support.
Thank you so much, Mayor. May I ask Dr. Low, please?
Absolutely.
Thank you.
Hi, Khaled. Go ahead with your question.
Welcome back, Dr. Low. How are you?
It's nice to be back. Thank you.
You're welcome. Earlier on your briefing, you urged people to cooperate with the health workers if they are being contacted for tracking or tracing. Can you please tell us what kind of issues or problems do you face or your team face later, so that we can spread even the news?
Yeah, no, thanks, Khaled, for asking. And it's important for me to stress that the vast majority of people are often very good about cooperating with contact tracing and really helping all of us to get the information that we need to stop the spread of COVID-19 in our community. Certainly, I recognize many other people are not familiar with contact tracing. It's a concept where you do go in, we do ask a lot of personal information, trying to figure out where you might have been, who you might have been in contact with, other health conditions, or accessing health services that may have led to this. And so there's a lot of personal information that gets pulled out in the course of contact tracing, and that's why it's so important and vital for us as a public health unit to ensure that that privileged information that we are given is used, is handled in the appropriate way, while it is being used to essentially control the outbreak and get in touch with people who may have been exposed. So, with all that to say, we are healthcare workers. We're public health and healthcare workers who are, involved in this. We take this very seriously, and I think all of us have been grateful for the participation of many people in making sure that we're able to learn a bit about their lives, but use that information to stop the spread of COVID-19 from circulating in our community. But thank you very much, Khaled, for the question.
Was the last question, and this concludes today's press conference. I want to thank everybody for their patience. I know we got started a little bit later than usual today, and on behalf of the mayor, thanks for participating. Have a great day and stay well.
Thank you. Thank you, one and all, for participating today. Thank you for coming, Dr. Lowe, Tim. Wonderful. Thank you. So you have